Welcome back to the Best PT Podcast. This is episode 3.11, talking about neuromuscular pharmacology. 5 main types of drugs used in neuromuscular pharmacology, the first being antiepileptic agents. The mechanism of these drugs is to reduce or eliminate seizures by inhibiting the firing of cerebral neurons. The purpose is to reduce seizure activity. Side effects include ataxia, behavioral change, headache, and blurry vision. Implications for PT: you must know how to respond to a seizure with these patients and be aware of environmental triggers that can induce epileptic seizures. Examples include clonazepam, valproic acid, dilantin, and Neurontin. Antispasticity agents work by promoting relaxation in spastic muscles by binding either within the central nervous system or the actual skeletal muscle cells. The purpose is to reduce increased tone or spasticity secondary to pathologies such as stroke, spinal cord injury, or multiple sclerosis. Side effects include drowsiness, confusion, headache, dizziness, muscle weakness, and liver toxicity. PT implications: patients may lose their functionality as spasticity decreases. They may have relied on those spastic muscles for posture and balance. Example drugs include baclofen, Valium, and dantrolene. Cholinergic agents work by mimicking acetylcholine and binding directly to cholinergic receptors or inhibiting acetylcholinesterase activity, which is the enzyme that breaks down acetylcholine. The purpose with these drugs is to treat glaucoma, dementia, or conditions such as myasthenia gravis. Side effects include bradycardia and bronchoconstriction. Implications for PT: these patients are much more likely to experience a drop in heart rate and/or dizziness or problems breathing with activity. Examples include Duvoid, Cognex, and Pilocar. Dopamine replacement agents work by crossing the blood-brain barrier to transform into active dopamine chemicals. The purpose is dopamine replacement for those with Parkinson's disease or Parkinsonism disease. Side effects include heart arrhythmias, orthostatic hypotension, mood, and behavioral changes. Implications for PT: you should know that physical activity is the most effective approximately 1 hour after taking these drugs, especially levodopa. Examples include Cinemet, which is the name brand of levodopa. And finally, muscle relaxers. These work by binding to skeletal muscle cells with the purpose of treating muscle spasms secondary to musculoskeletal or peripheral nerve injuries. Side effects include heavy sedation, drowsiness, dizziness, nausea, vomiting, and headache. PT implications: be aware of all of these side effects. Examples include Valium and Flexerol. That's it for episode 3.11, talking about neuromuscular pharmacology. Episode 3.12 will talk about specific neuromuscular pathologies. The outline will be in the show notes as always. Thank you for joining me.